One of the great advantages of this show is I get to expose people about things that really make a difference in your life. You know, raise awareness about things that can really improve the way you live day to day. Freedom Mini Dental Implants is one of those products, and with me now is Dr. Regan Ackerman, and I'm really eager to introduce you to Mr. Nash over here, Tim Nash. Tim, welcome to the show.
Oh, thank you.
Before I get to you here, big Notre Dame fan,
Yes,
Dr.
sir.
Ackerman, obviously you two click, you make friends with your patients because you do a positive thing. For those who are not aware, just now tuning in, tell them what Freedom Mini Dental Implants do, what you do.
Certainly. So I do a dental implant that is a lot less invasive than the traditional surgical implant. It's called a mini implant just because it's a smaller diameter implant, but a lot less invasive. I don't have to have as much bone. People that were told they weren't candidates for implants before can be candidates for the mini implants. One of the biggest ways I use these mini implants are for what we call denture stabilizations, or to get rid of the denture completely. So people that are struggling with that floppy denture, especially the bottom one, or are using tons of glue, they don't go out to eat because they're afraid their denture is going to fall out, we can use the mini implants so that your denture can snap onto the implants and get rid of that glue, or we can get rid of the denture completely with the permanent teeth. So there's a lot of different ways we can use the mini implant.
And I always like to point out the positives, and there's many of them. In fact, I cannot find a negative in that, okay, it's not as invasive at all. It's not surgical. It's really simple and virtually painless.
Yes. Yeah, no incisions. Don't have to take people off blood thinners, a little numbing, not putting you to sleep, a lot less invasive. I know we talk about it a lot. It's the laparoscopic version of implants.
And before you call about cost, it is a third to sometimes even a half less expensive than the former method, correct?
Yes, definitely a lot less expensive than the surgical method.
So it doesn't hurt. It's just as durable.
Yes.
You're going to look fabulous. You get to make a new friend, Dr. Ackerman. And now that brings me to Mr. Nash, who is a friend of ours now. We become new friends, right, Tim? We're good?
Sir.
We're good. Okay. Tell me, Tim, if you would, about your life prior to going in to see Dr. Ackerman. What kind of issues were you having?
Well, there's a lot of foods that you just can't eat. You kind of like not as confident. You don't want to smile and show like these rotten teeth or whatever, you know. And so when you get them all pulled and you get these in, I told her, the first thing I told her was, I want to be able to eat beef jerky.
That was his #1 food.
Isn't it funny how everyone has something different? I'm a beef jerky fan myself. Okay, go ahead. What brand do you like? Throw it out there. Give them a free commercial, Tim.
I like Jackal Links pretty well.
Oh, yeah. Okay, I understand. So because it's chewy, you couldn't do that. That's right. And as far as the confidence that you have now, because when you walked in the door, I said, Tim, give me a smile, because I wanted to see you smiled nice and big. Your confidence is now, it's changed, hasn't it?
Oh, yeah, absolutely. When you go up to meet people, like in any kind of social circumstances, you know, you're more confident smiling. It just gives you a more confident attitude, you know, just to talk to people and everything.
Well, I'm glad you had such a positive experience. So Tim, tell me now, how has your life changed? Other than, you know, hey, we love beef jerky. That's a big part of it.
Yeah.
But maybe some of the other positives, Tim.
Just getting out, and, you know, I find myself smiling all the time now, you know. It's made me kind of a happier person and just more confident in everything I do, really, because I'm not, you know, trying to shy away and not, you know, trying to smile at people. And now I'm just like real open and like, you know, I don't know, life's more fun.
Tim, you have a very engaging personality, and the fact that you had that was squashed in any way saddens me. So I'm happy for you. It's good to see you smiling. Notre Dame fan, and you also mentioned, did you say you're a 49er fan?
Yes, sir.
Sorry about that, Tim.
Yeah,
it's
well,
okay.
These things happen.
Okay, tell us about there's a couple of options here, Dr. Ackerman. So maybe tell us a little bit about Tim's specific case and what you did for Tim.
Yeah, certainly. So we did this snap-in denture for him, and I can certainly show the model. There's his before picture. So yeah, Tim came to me. He had, you know, teeth were failing. He only had a few teeth left.
To no fault of his own.
No, to no fault of his own. And like he said, so he couldn't chew what he wanted to, couldn't smile, you know, confidently. So he had those remaining teeth extracted. We made him regular dentures that he did wear while he healed a little bit. He can certainly talk about that as far as wearing regular dentures versus dentures with implants, and how vastly, you know, that just changes things and makes those dentures so much better. So then we did the snap-in dentures for him. And so yeah, when we do the snap-in dentures, it's really great because the day I put the implants in, I just numb you up, a little local anesthetic, don't put you to sleep, and the same day I put the implants in, you will leave that day with the denture snapped in. So same day, put the implants in, they don't have to heal up another 3 to 6 months like the surgical ones. You can leave that day with the denture snapped in and, not have to use denture glue anymore, not worry about that floppy denture anymore. So looking good, Tim.
I'm telling you, I look at these pictures, Tim, and I think we can all agree, 20 years younger. I mean, Harry Styles, Justin Timberlake, they better watch out. The ladies are all over you. You can't get. No, but what reaction have you gotten from your friends? Seriously.
A lot of like the guys that I've known for a long time, and girls I've known for a long time, they all like, man, your teeth look great, It's like, and they're just, they all say you just look like a different person, and that's why I'm still the same old me, It's just, but I feel a lot better.
Yeah, and a lot more, I guess, eager to smile and comfortable with your smile, and confidence means a lot. And hey, eating beef jerky's not bad either, Tim. I'm with you on that
that's
one.
Good stuff, man.
So if you'd like to ask Tim any questions or Dr. Ackerman any questions, 571-5263. We'll take calls if you want to know about Tim's experience. Perhaps if you're a candidate for Freedom Mini Dental Implants. One more question before we go here. A lot of the questions that we get pertain to cost, and I know it's individual. We talked about how much less it is.
Yes.
But I think people would, and I know you can't really quote anyone on the air, it's impossible to do, but I think they'd be borderline shocked that the technology is less than the former technology, yet better.
Yes. Yeah.
I mean, I think that's amazing.
Yeah.
It's all
less
good.
Invasive and less costly than the surgical implants. So,
Can't beat that.
It still can be an investment, but we do have financing plans. And when they call, for the consultation is no charge. I take a 3D X-ray because I want to make sure that you have enough bone and everything's good. So there's no charge for the X-ray or the consultation. So it's definitely worth scheduling a consultation to see, the process. We'll go over cost and see if this is something that can help you out and get you eating beef jerky too. Like
there you go. 571-5263. We'll take a quick break and then more information on Freedom Mini Dental Implants. They can change your life for the better. We'll be right back. Freedom Mini Dental Implants. Dr. Regan Ackerman is here. Tim Nash is here as well. He is a patient and a newfound friend. And if you have questions for either of them, 571-5263. Dr. Ackerman, we had a call. A young lady called in and she was curious about, okay, she's having problems with all of her teeth. She still has 13 or 14 teeth, but they're not doing well. Again, genetics, nothing she could do about it. You know this happens.
Yes.
Don't be embarrassed kind of thing. But she was worried about, she gets nervous. I think a lot of us have been jaded going into a dentist, whether it be a root canal or whatever. I want you to stress this, you don't need sedation for a reason, right?
Right, because it's so less invasive. You know, I'm not making any incisions or stitches. You know, we'll get you numb. And so I've had so many patients tell me that, oh my gosh, that was so easy, you know, compared to a root canal or a filling or a crown, because it's not that high-pitched drill for an hour that people are used to, you know, for a filling or a root canal. So yeah, we don't do sedation, but that's because it is so less invasive placing the mini implants. The one thing you can do sedation for is we do refer out a lot of the extractions to an oral surgeon, and they can do sedation for the extractions if you need teeth removed.
Okay, Tim, tell me about your experience with Dr. Ackerman as far as, you know, I think a lot of people are curious. It's natural. Pain threshold, did it hurt? What did it feel like to you, Tim?
There wasn't really any pain while it was going on, because you do get numbed up. But like the day after the numbing wears off, there's a little bit, but it's not terrible. I mean, it's, you know, it's something you can deal with.
Sure.
And by midnight that night, it was gone too. So I was ready to go. And
so for those who may be watching now, and maybe that's why they are apprehensive, because they're worried about the experience. They know it's less costly. They know it's less invasive. If someone's a little bit like, should I do this? What would you tell them?
Absolutely. I mean, it's just a great feeling to be able to, you know, to interact with the real world, you know, like on a normal basis, not trying to hide anything, you know.
Yes.
It was a great experience for me. I can't thank her enough. I mean, to be honest with you,
and we can't thank you enough for coming on the show, because I do think, you know, that it's nice to hear from someone who's experienced it. It's one thing for us to say it, and of course you see it every day. This isn't unusual.
I can talk till I'm blue in the face about this procedure, but to hear, you know, firsthand experience, especially, you know, from Tim. And you're right. I mean, our patients become our friends. We joke around and have a good time with Tim in the office. But yeah, and I think to be able to get him out of, you know, using denture glue and a floppy denture and just the confidence, and for people to be able to see his great personality and his smile, and like you said, not for him to hide behind that, it's life-changing for sure.
571-5263. We had a caller, did not want to go on the air, and I understand, but here's her dilemma. We've heard this question before, but for those who have not heard the answer, she said her mom has been told, she's gone into a doctor, says she doesn't have enough bone to get implants.
Yes.
Okay, so tell her why Freedom Mini dental implants are different.
Yes. So since it's a smaller diameter implant, I do not have to have as much bone. And I'll show this model here, but it just, you know, the little pilot hole I have to make to place an implant is a lot less, you know, I just don't have to have as much bone. I don't have to do sinus lifts. I don't have to do bone grafts. So a lot of people that were told they weren't candidates before, even if you may have had a condition called periodontal disease, a lot of people lose their teeth because they don't have any bone left around their teeth, known as periodontal disease. A lot of times you can still be a candidate for the mini implants.
Yeah, let's take a look at that. Yeah, here we go. That's a jawbone, right?
Yeah, so imagine, you know, this is kind of your lower jaw bone, and this kind of shows the difference. So the little hole that's hard to see, that is the hole I have to make when I place an implant. So I don't make any incisions or stitches, just numb it up a little bit, make this little pilot hole through the gum into the bone. And Tim can definitely speak about that. We did that a couple times on him, versus this big, you know, surgical implant where usually they make an incision, they have to flap the gum open, and it has to heal up a lot longer. But this shows how much, you know, they need more bone for those bigger implants versus the pilot hole that I need to make to place a mini dental implant. It's just a smaller diameter implant, so a lot less invasive. I always say, you know, I don't need a lot of bone, I just need some bone, and that's where the consultation comes in. It's no charge for the consultation, and I take a 3D x-ray to confirm that you have enough bone, you know, to place the mini implant.
Dr. Ackerman, I'm going to work you a little bit here, because I know you have another model, and I want you to choose the model that shows what the process that Tim went through, if you don't mind. Which one would that be?
Yeah. This one right here. Yes, so this is the snap-in denture, which is what Tim has. So this kind of shows you, so, you know, imagine this is your mouth without teeth, the gums, and then these are the mini implants, or post, as a lot of people will say. And just, you know, as with Tim, we just numbed him up, local anesthetic, you know, so he was awake, but no high-pitched, you know, drill or anything like that. I make those little pilot holes that I just showed you and place these implants. And then the same day I place the implants, I can put these attachments inside your denture. So then you leave that same day with the denture snapped on to the implants. So no more denture glue, no more worrying about your denture flopping. You can eat beef jerky again, steak, all those things you missed. You will take it out once a day, rinse and clean it, and then snap it right back in, and you're good to go.
All right. Tim, you mentioned your favorite, beef jerky. Okay. So were there any other foods that, because of the condition of your teeth prior to seeing Dr. Ackerman, that you couldn't have, that you missed?
Ribs off a bone, chicken off a bone, you know, I mean, anything where you had to pull with your teeth, you couldn't even do it like with the dentures, the glue-in dentures, because they come loose on you. The bottoms were real bad about popping loose. Now,
no worries.
No worries.
Yeah, and
I can go out here and eat rock if I want.
You know, and everyone knows about the nutritional value of meat, which you talked about in steak and beef jerky. Yeah. You know, a lot of vitamins and minerals and fruits and vegetables. I mean, you know, apples, carrots, things that we know are so good for you. You probably had to stay away from because you were afraid that you know, the glue, right?
Yeah, I just told her earlier that I've been eating apples and just about any kind of fruit now. You know, and I love it. I mean, it's like. Grapes, you couldn't really chew the grapes up, so you're basically swallowing them whole. And so it's a lot better now.
Tim, now I know you miss the taste of that glue, though, right?
Oh God! You had to drink an extra beer to get that taste out of your mouth.
We can do that together, okay? Glue or no glue? I'm in on that one, Tim. All right, so more from Tim Nash. If you have any questions for Tim about his experience at Freedom Mini Dental Implants, if you want to know if you're a candidate or perhaps a loved one has issues with their dentures, or maybe they just have a tooth or two, we'll talk about that as well because they can help you. Dr. Ackerman is more than capable of helping you. There it is, free consultations. We'll talk about all of that. If you have a question, 571-5263. We'll return. Freedom Mini Dental Implants. Tim Nash is here. He is a patient and a friend of Dr. Regan Ackerman. If you have a question for either, 571-5263. We'll go to the phones. We always get a lot of calls because I think people go, it's almost too good to believe. So William joins us now. William, welcome in. Thank you for calling.
Thank you.
You have a question?
Yes, I do. I just had some new dentures made. Doesn't have the palate. It's just a horseshoe. Mm-hmm. I pick up the dentures Friday, and I'm just wondering if those dentures would be could I use those dentures to get an implant?
Yes, great question. I'm so glad you called. So yes, a lot of times we can use the same denture as long as you're happy with like the looks and the aesthetics of that denture. You like the way the teeth look, and you just want them to stay in better, then yes, a lot of times we can use that same denture. Sometimes not to get too technical, but sometimes we may have to do what we call reline, where we just redo the inside of the denture to kind of get it ready for implants. But if you like the teeth and the shape and the size and the color, then a lot of times we can use that same denture, and then obviously that will save you money as well and decrease the cost. So definitely, you know, pick up that denture, schedule a consultation. We'll see if you have enough bone, and you know, hopefully we'll be able to use that same denture, place the implants, and you leave with that denture snapped in, and then you don't have to use glue, because you may be aware when they trim out the roof of the mouth, the palate like that, it does, you know, you lose some suction from that top denture, and it won't stay in as well unless you get implants.
All right, usually our phone lines are packed, but right now that we have openings, so 571-5263 if you have a question. Tim, you and Dr. Ackerman and I were talking during the commercial break, and I said, you know, aesthetically, it's nice. You look great. You get to eat the foods, and we've talked about that you love. You miss those, and you're back there. And I asked you, I said, but Dr. Ackerman was saying, you know, what really made the big difference? What have you really noticed? And you said confidence, right?
Yeah, that's the big one. It's like for job interviews or any kind of thing where you have to, you know, communicate. You're not trying to do like this the whole time. You know, when you're trying to communicate, you're smiling. And I think they like that. It puts them more at ease too, you know, during an interview or something. So I don't know, it just makes everything a lot better, I think.
Yeah, that first impression, a smile is really your calling card, and you have a beautiful smile, Tim. I mean, I feel comfortable telling you that because, you know, you exude confidence. I can tell now that you have that, and it does make a difference, doesn't it? I think people sometimes, don't get me wrong, I think you look here and look how much younger you look. It's great. All that is fabulous, but the confidence in your life to get in pictures at a wedding. Have you noticed that
Yeah.
now you're more eager to jump into a family picture, right?
Yeah, my grandson just got married recently, and instead of being in the back hiding behind somebody, you know, I was out there for the pictures, you know, so.
That's
Fabulous.
awesome. That's
See,
great.
that makes for good memories.
It sure does. Makes me feel so good. Yeah.
You hear these stories all the time, Dr. Ackerman. We've mentioned, you know, all the positives and the changes in people's lives. What other kind of things do you hear? Is a lot of it about the physical appearance, or do you hear more about foods they love, or confidence, or what do you?
I mean, honestly, it's a combination of everything. You know, I can make it look good, but if it doesn't function well, they're not going to wear it or use it. So it really is 50-50. And every patient is different. You know, I have some people that want it to look good no matter what. They don't care. And then I have other, like, they're like, I don't care if the teeth are purple. I just want to be able to eat, you know? So everyone is different. So it's definitely a combination. And that's where we are a small operation. You know, you will deal with me. I'm the only dentist there. My husband works with me, and we have one other employee. So we're not corporate. We're a very small operation. So you're going to see us, and you're going to see me every day. And I always say when we start treatment together, we're kind of married together. We're in this together. So, you know, I cater to your needs and what you know you're hoping to accomplish with this process as well.
Let's grab another phone call and welcome Hazel to the show. Hazel, thanks for watching. Thanks for calling. You have a question for Dr. Ackerman or Tim?
I got one for Dr. Ackerman.
Yes.
I have what they call trigeminal neuralgia in one side of my face.
Okay, yes.
And it hurts a lot, you know?
Yes.
So I was wondering if that would have any effect on getting implants.
So I have placed implants on patients that have had that trigeminal neuralgia. You know, you do have to worry. Sometimes it may trigger a little bit, you know, exasperate it for a little bit until the implants heal. But I have definitely done it on patients with trigeminal neuralgia. And sometimes, honestly, it helps because a lot of times if you have a denture or a partial or something that's moving and flopping, and it could be triggering the pain from the trigeminal neuralgia. So when we can stabilize things, sometimes it does help. So, you know, that's certainly a conversation we would go over at the consultation. But you could still be a candidate for the mini implants, even with the trigeminal neuralgia, certainly.
Trigeminal neuralgia. Okay.
Yeah.
Right over the old head, Tim. I don't know about you, but
my dental school education's paying off right now.
I'm not sure I can even say what is she talking about? Okay, let's show another model because there are options here. The snap-in denture for Tim,
yes.
But some other folks might say, you know, I don't want any plastic whatsoever. You can do that too, right?
Yes. Yep. So we can get rid of the denture completely. So I'll show this model.
This is your gum, right?
Yes.
Your gums.
Yeah. So this is what we call the permanent teeth. I had to bring in kind of an older model today, but so when we do this, we're going to just place more implants. And same way, no incisions, no stitches, just going to place as many implants kind of as size and bone of in your mouth allow. And then we're able to make just a bridge of teeth. So you get rid of the denture completely. So no plastic on the roof of your mouth, no bulky denture anymore. And then these teeth get cemented permanently onto those implants. So they no longer come in and out. It's kind of the closest thing to having your natural teeth back. You'll brush them, just, toothbrush, toothpaste. We give you a water pick to kind of flush and keep things clean. And you'll get them cleaned every 6 months, just like you do your normal teeth. But you can just see, then you really don't have the bulkiness of the denture anymore. You can really taste your food again. And they're cemented permanently in there. So, we kind of tell people it's like growing your teeth back, the closest thing you can get.
And we touched upon this, but before we go, I want to mention this, that perhaps you had a car accident or something genetic and you're missing a tooth or two. You can help them too, right?
Yes. Yeah. So I actually have a model of that as well. Like you said, a lot of people may be missing a front tooth for whatever reason, baseball accident, and we can do a single tooth. So place the implant the exact same way. Great thing about this is it doesn't have to heal up another 3 to 6 months like the big surgical ones. Within a couple weeks, we'll have the nice pretty tooth ready for you, and then it gets cemented on to that implant permanently, so no more flipper or partial. If you have one, you know exactly what I'm talking about because you hate it. We can also do multiple teeth. It doesn't just have to be one tooth. It could be 2 or 3 teeth, or one molar in the back. A lot of people have lost what I call your big chewers, and they want something to chew with. So same thing, we just do multiple implants, and then the teeth are splinted together, and then they get cemented on or glued on to those implants permanently. So then you no longer have anything that comes in and out, and you can chew again.
All right, free consultation, Freedom Mini Dental Implants. Tim, before we go, you and I are going to get together for that cold frosty wheat soda. And what we're going to do is we'll have like a memorial for your denture glue, like a goodbye to denture glue. Yeah, well, I think I'd enjoy that a lot with you. We'll do that, okay?
We'll do that.
Let's
That
do it.
sounds
All right.
like a great idea.
Tim, thank you for coming on. Dr. Ackerman, it was a
thank you.
pleasure. Again, I can't stress this enough. The consultation is free. It is less invasive. It is less costly. All these advantages, and you're going to look fabulous. Again, Freedom Mini Dental Implants will be back. Don G will join us, and we'll talk about what's happening at 2 o'clock. Wave Country with Don G.